Hi, I'm David Pope from Clinical Edge, and welcome to this week's 5-minute physio tips on plantar fasciopathy and how you can improve your results with it. So plantar fasciopathy is a really common source of heel pain in patients, and particularly in your runners and your larger middle-aged ladies. It can happen in all sorts of patients, but they're your two most common types of patients that will present with plantar fasciopathy. So you'll notice I reference it as plantar fasciopathy. It doesn't have, we don't call it plantar fasciitis any longer because it doesn't have that inflammatory component that you associate with an itis, and it tends to, which would encourage patients to want to use anti-inflammatories, rest it, do that sort of passive treatment approach. Whereas if we think of it as an opathy, like you would a tendinopathy, it encourages more of a load management strategy, loading it, strengthening, that sort of thing. So your language is really important, and we're going to refer to it because of that as a plantar fasciopathy. So we want to get good treatment results with your patients that have a plantar fasciopathy, and our first tip that I've got for you is to stop pressing, needling, or rubbing the sore part. So because it behaves a lot like a tendinopathy, it happens oftentimes after a period of overload or increased load. It happens, you get that morning or startup type of pain, and so it's behaving a lot like a tendinopathy. Let's treat it like a tendinopathy. So it's all the research shows that tendinopathies don't tend to respond really well to rubbing them, to pressing on them, doing other manual stuff directly to the tendon, but they need that loading approach to them. So stop rubbing and stop your patients rubbing that sore point. You're only just going to irritate some already irritated tissue at that plantar fascia insertion. That's the first tip. Our second tip is to use isometrics. So just like you would with a tendinopathy, you can trial isometrics to see if you can get a pain reduction and an increase in the person's function by using isometrics. So you can use somewhere in the realms of 3 to 5 lots of 30 to 45 seconds, and you can start at the lower end to see if you can get a good pain reduction and see if that improves with increased numbers of isometrics. So isometrics, you could use something like a heel raise on the floor or something that's in more of that mid-range position. And remember, you need a decent amount of load. You're looking at around that 70% of maximum voluntary contraction with your isometrics to get a good clinical result. So start with isometrics, see if you can decrease their pain and settle it down. Our third tip is then incorporate high loading. So you want to progress like you would for, say, an Achilles tendinopathy. You're not just going to perform your isometrics, but you want to incorporate your high load so that you can develop that tissue tolerance, the ability to cope with load, and the ability to cope with all the activities of daily living. So progress to a high load strengthening program for your plantar fasciopathy, obviously slowly. And this is going to be generally most effective in your running population rather than your middle-aged lady type of population. So the runners will tend to respond often a lot better to that loading approach than will the middle-aged ladies. So there you go, starting with our isometrics, progressing into our concentric eccentric, and gradually increasing the load that you're using for that high load strengthening program. Our fourth tip is to modify the patient's load. So like we know, tendons like high load, but they also like periods of recovery. And so make sure your patients are giving they're not on their feet all day if they can, having breaks to sit down, that you reduce their running if they're a runner. You can see if they've got a really irritable plantar fascia insertion. Reduce their running if it's causing it to be irritated for a couple of days. Bring it back to the point where they can walk for 3 to 5 kilometers to start with, depending on how far they like to run, and make sure they're pain-free the next morning after that walk before you start that running. So that's our next tip, is modify your patient's load, get them coping with that before you progress it. Our last tip, if you're still not quite making the progress that you'd like to, is you can incorporate taping and or orthotics. So taping is a really nice way to start. You can use something like your low dye taping. We've got plenty of examples of that on the Clinical Edge website. So you can use your taping techniques to offload that plantar fascia, provide some support. If that's going well, you can incorporate some orthotics, and off-the-shelf orthotics are great for just providing some support and offloading. You do want to make sure though, if you are taping and or providing orthotics, that you've got a change in your patient's pain or symptoms, and you also improve their function. So check them with the tape on or the orthotics. Check their single leg stand, single leg squat and step forward. Check that that's not making their balance worse, or that it's making their pain and function worse. If it's doing either of those things, give up on the tape or the orthotics, modify it or try something else, because it really should improve their pain and also their function. So there's some tips for you to help with your treatment of plantar fasciopathy. Hope that gets you some great results. And if you found us anywhere but on our website, head on over, check us out at clinicaledge.co. We've got lots of great resources for you there. Have a great day.